Hello doctors and friends, my name is Tiara with student number 105 and we are from SGD B6 and today we are going to present our student project titled Juvenile Idiopathic Arthritis. Here is our agenda. So the first is background. Juvenile idiopathic arthritis is sometimes known as juvenile rheumatoid arthritis. It is one of the most common chronic rheumatologic disease to happen in childhood. Chronic means it may happen for a very long time ranging from months to years. Although the detail of the disease is not fully discovered yet, it is believed that the genetic plays a role in this disease. GIA usually occurs in children ranging from 6 months to 16 years old, and most commonly in children aged 1 to 3 years old. Symptoms that occurs are usually joint pain. In this student project, we are going to focus on discussions about several aspects of the disease. Why is it important? It is because the disease may lead to serious and more further damage, and if not handled properly, and also diagnosing this disease is quite challenging as it resembles many other diseases. Thank you.
Hello doctor and friends, my name is Dona Ulisi Dauruk, student number 165. The purposes of our student project are to explain the general informations, epidemiology, etiology, risk factors, pathophysiology, signs and symptoms, supporting diagnosis, differential diagnosis, treatment, complications, and prognosis of juvenile idiopathic arthritis. Through this paper, we hope the clinicians can understand that information and make the best choice when designing and giving a drug regimen for the patients. And the community will also benefit a lot as they could avoid the risk factors and do the preventions of juvenile idiopathic arthritis. Thank you.
Hello doctor and friends, my name is Friendly Valentin with student number 086. So what is juvenile idiopathic arthritis? It is a non-specific condition but a concept. Includes all types of arthritis that are characterized by onset before 16 years old and lasting more than 6 weeks with an unknown origin. It is a leading cause of short and long-term disability in children. It encompasses a heterogeneous group of conditions, all presenting with joint inflammation, but with distinctive clinical manifestation, cause and outcome, and perhaps genetic background and pathophysiology. It has been classified into 7 categories based on associated clinical and laboratory features. New studies have shown an incidence and prevalence ranging from 2 to 20 and from 16 to 150 per 100,000 populations. Thank you.
Good afternoon, doctors. My name is Vanessa S., student number 121. There is no exact incidence rates of juvenile idiopathic arthritis, but they appear more frequent in some populations, such as Aboriginal people in Norway and British Columbia. There are 148 cases per 100,000 populations in Norway, while Japan reported a low incidence. There are also 8.3 per 100,000 populations in Caucasian people, and most mortality incidences in Europe are related to amyloidosis, and in US they are related to infections. There are some forms of juvenile idiopathic arthritis that appears in individuals, such as oligoarticular in 30% of cases, polyarticular RF negative in 20% cases, polyarticular RF positive in 5% cases, psoriatic in 5% cases, systemic onset in 5% cases, enthesitis related in 25% cases, and the rest are undifferentiated. Based on the sex, juvenile idiopathic arthritis is more common in girls in most forms, and based on the age, they appear more frequent in children aged 1 until 3 years. In Indonesia, there is no up-to-date data that shows both incidence and morbidity rate of this disease.
My name is Arista, student number 237. The cause and trigger of juvenile chronic arthritis remains unclear. Abnormal immune response triggered by interaction between environmental factors and genetically susceptible of individual. Specific HLA alleles or non-HLA genes may be vulnerable to particular juvenile chronic arthritis subtypes. It was found that cigarette exposure of O3 in the second year of life, and the maternal occupational exposure were identified as potential risks of juvenile chronic arthritis, which warranted further study.
Hello doctor and friends, my name is Aswatasha, student number 224, and today I will explain pathophysiology of GIA or juvenile idiopathic arthritis. Now, immune system is related to the pathophysiology of GIA. The immune system involved are cellular and humoral immune system. Now, tumor necrosis factor or TNF-alpha and interleukin 6 and 1 is involved and is the main focus of GIA pathophysiology. Now, in juvenile idiopathic arthritis, there is thickening and inflamed synovium, and there is edema of soft tissue occurs around the joint. Cartilage begin to erode in result of collagen breakdown by proteolytic enzymes, and thus synovitis and joint effusion occurs. Cartilage destruction also occurs at the joint periphery by pannus. Some forms of GIA may occur with rheumatoid nodules. Now, the risk of having flexion contracture can be increased by muscle spasm and joint inflammation. There are risks of having ankylosis of affected joints over time. During active disease, growth retardation may occur, and with severe disease, corticosteroid treatment might significantly affect growth retardation. Thank you.
Good afternoon, doctor. My name is Andikita Pramisti, student number 044. Now I'm going to talk about the sign and symptom of juvenile idiopathic arthritis or GIA. So the symptoms is different from one child to another, and the most common symptoms that led to seek medical attention, including first is arthralgia, it's about 39%, arthritis 25%, fever 18%, that followed by skin rash 8%, abdominal pain 1.3%, uveitis 1.3%. So the clinical manifestations is also depend on the subtype of arthritis present. The GIA is classified into systemic GIA, polyarticular, oligoarticular, enthesitis-related, psoriatic, and undifferentiated GIA.
My name is Chukode Istra Plantek Mayun with student number 252. Diagnosis of juvenile idiopathic arthritis is primarily based on clinical finding. However, some imaging and laboratory tests are available to support the diagnosis. The laboratory findings include 1. Increased inflammatory markers such as ESR and CRP. 2. CBC showing anemia and elevated white blood cell count that indicates a chronic inflammation. 3. Positive ANA test as it is associated with many types of arthritis and risk of developing asymptomatic and chronic uveitis. 4. Positive rheumatoid factor test in patients with polyarthritis may be a sign of an aggressive disease and poorer prognosis. 5. The HLA-B27 gene is associated with symptoms of enthesitis-related arthritis. It also indicates susceptibility of axial arthritis development. 6. Anti-CCP antibodies may show severe disease but not routinely performed. 7. Other tests such as double-stranded DNA, ENA, C3, C4, Ig may help to rule out the possibility of underlying connective tissue disease or vasculitis as the cause of arthritis. Imaging tests include 1. Plain radiographs are the most accessible, less costly, and good method to evaluate the joints. 2. Ultrasound may confirm joint effusions, particularly in the hip and shoulder joint, where fluid may be difficult to see clinically. 3. MRI is more sensitive in detecting inflammatory changes in the joints and cartilage. It can also assess early changes in the soft tissue and late manifestation including erosion, loss of joint space, cartilage damage, and involvement of ligament. 4. Technetium-99 bone scan is also helpful for detecting the early stage of inflammatory arthritis. Thank you. Next.
Hello, my name is Risma Danian, number 195. So, juvenile idiopathic arthritis or GIA is the most common type arthritis in kids and teens. Juvenile idiopathic arthritis or GIA has a lot of differential diagnoses. Leukemia is the single most important disease that is mistaken for GIA, because patients with acute lymphocytic leukemia can present with joint pain and arthritis. Other than that, GIA has similar symptoms with another disease, such as chronic polyarthritis, SLE, pediatric sarcoidosis, pediatric acute lymphoblastic leukemia, somatoform disorder, Lyme disease, Epstein-Barr virus, Kawasaki disease, and Behçet syndrome. Thank you.
My name is Jennifer Luisa, student number 018. Some main purposes of JIA treatment includes controlling symptoms, preventing structural damage, optimizing growth, development, and quality of life. Based on the clinical guideline by American College of Rheumatology, there are several treatment options. Combination therapy of intravenous infliximab with a DOMARD disease-modifying anti-rheumatic drugs is recommended, with subcutaneous methotrexate as a favorite DOMARD, which is preferred over leflunomide and sulfasalazine for its safety. Long-term systemic glucocorticoids is strongly advised against, as it causes side effects in children like osteopenia, cataracts, growth suppression, and weight gain. However, intra-articular glucocorticoids may be considered when arthritis is interfering with ambulation or daily activities, and where a need for prompt disease control arises. NSAIDs are also conditionally suggested as an adjunct. In children and adolescents with JIA,
My name is Shanti Dewi with my student number 142. If not treated well, juvenile idiopathic arthritis can lead to various complications. The most common ones are anesomelia and joint contracture. So anesomelia or leg length discrepancy is a condition of noticeable unequal length of the lower extremities, while in joint contracture, joint becomes hardened and rigid due to limited range of motion. Other complications include growth retardation, amyloidosis, osteopenia, osteoporosis, and then serious hip problems with the need of hip arthroplasty, erosive arthritis, etc. GIA patients should also be aware of the more severe complication, like the macrophage activation syndrome or MAS. MAS leads to a more serious dysfunction of the CNS, range from lethargy, irritability, seizures, to altered mental state. Though MAS is said to occur in only 10% of the GIA cases, patients should be aware as it could lead to death because of multiple organ failures. All of the complications I've stated could affect the GIA patient's quality of life greatly, so immediate treatment is advised so that the complications won't occur. Thank you. Next.
My name is Jennifer Jasna Gunawan, student number 068. Due to the improved anti-inflammation mechanism in novel drugs, the prognosis of GIA has improved significantly. However, the disease course of GIA is highly unpredictable. It could be self-limiting in some patients and unremitting with substantial risk of joint destruction in others. Recent study reported 48.8% of patients had remission with off medication and 49.9% had remission on medication. One study found a reduction in permanent damage across GIA categories. It includes higher rates of remission in patients with systemic GIA and a lower progression of extended oligoarthritis. However, 1 in 4 patients still have disease activity in early adulthood, and 1 in 2 is still receiving anti-rheumatic medications. Patients with polyarthritis have the worst disease course. Several reported complications among GIA patients include uveitis around 10% and major uveitis complications around 1%. Another study found a 1% incidence of major ocular complications, such as cataracts and band keratopathy among GIA patients. Studies have also found corresponding levels of physical disability, pain, and well-being at 3 and 19-year follow-ups, even though there's an increase in physical disability. They concluded pain, physical disability, and active joints at baseline as early predictors.
Hello everyone, my name is Diah Iswitari, student number 173. To summarize, juvenile idiopathic arthritis broadly affects children ranging from 16 months and 16 years old. Genetics are said to cause this disease, however, it is still unclear. There are various symptoms of GIA, such as inflamed synovium, eroding of the cartilage, and joint effusion. Laboratory findings and imaging tests are some of many ways to establish the diagnosis. Treatments of GIA can be divided into 2 types, which are strongly recommended treatment and conditionally recommended treatment. Like most diseases, if not treated well, GIA can lead to various complications, and it ranges from mild to severe. Preserving joint physiological function can be easily achieved through early diagnosis and treatment. However, the disease course of GIA is highly unpredictable. Thank you.